Good afternoon, everyone. Welcome. Thank you so much for joining us today to talk about a people's budget that advances well-being for all in North Carolina. We're so glad you're taking your lunchtime or an hour out of your day to be with us to talk about this important work ahead for our state to make sure that our funding matches the priorities that people have in community. My name is Alexandra Sirota. I work at the North Carolina Budget and Tax Center. We're hosting this conversation to lift up the importance of state budget decisions as our North Carolina General Assembly comes back into session in Raleigh today and tomorrow this week. The North Carolina Budget and Tax Center is a nonprofit, nonpartisan organization. We document economic and fiscal conditions in communities. We do that work in partnership with many of the folks that you'll hear from today and folks across the state who work to connect with community and lift up and connect with North Carolinians who have experienced poverty because our public policy choices have not delivered. We know as an organization that we can make choices and fund the priorities that people have to really deliver economic opportunity and the anti-racist outcomes that we need for everyone to thrive in our state. So again, we're so excited for you to be with us this afternoon to talk more about the state budget. So let's jump in. As I said today, the North Carolina General Assembly is coming back to Raleigh. The House and Senate have identified this week and 1 week in each of the following months as a time when they can consider various legislation to advance opportunity and advance agendas across North Carolina. What we know about this upcoming legislative session is that a focal point will be around the Medicaid rebase. The Medicaid rebase is the funding needed to keep the Medicaid program running at the cost it takes to deliver care and services across the state based on enrollment and the changing cost of care. Right now, state legislators have not funded fully the cost of delivering program services to existing Medicaid enrollees. And that is leading to the potential for provider cuts as of October 1st. So this is a time-sensitive issue, but we know that what North Carolina needs is a fully funded Medicaid program and a real plan for addressing the cuts that have been proposed at the federal level to Medicaid and other programs that help people lead healthier lives. So we know that'll be one topic. We also know it's possible that a number of veto overrides could be considered. These veto overrides really drive deeper division in our communities. The focus of these veto overrides that have been discussed are overriding the governor's veto of legislation that would have prohibited diversity, equity, and inclusion programming and investments across state government. And the second bill is a veto override of the governor's decision not to opt in to a federal voucher program that provides tax breaks for very high income households based on educational expenses. Those veto overrides really do create division and don't address the priorities that many North Carolinians are concerned about: the rising costs of living, the importance of their communities having stability and opportunity. And we are very concerned that if policymakers don't focus and refocus on what communities are calling for, that long-term will face some real challenges in the well-being opportunities that we all need. So we're here today with you all to come together and hear an update on the state budget, hear more from people across the state about the priorities that they see as urgent for state policymakers to focus on. And we're also here to provide some tools for you to get engaged and really call on your policymakers to take action to support well-being across our state. At the Budget and Tax Center, we know that without a state budget that pauses income tax cuts for the wealthy and profitable corporations, North Carolina will not be able to deliver the kind of opportunity that we know every person, every community deserves in our state. And so we're very grateful for you joining us, taking time out of your busy schedule to be with us to hear more about what's at stake this week as North Carolina General Assembly members come back to Raleigh. I'll take a moment and just share a little bit about what we mean when we talk about well-being. For our organization, we're really focused on the importance of well-being for individuals and communities. And we know that when basic needs are met, like food, housing, healthcare, as well as higher needs are met, like dignity, connection, and life satisfaction, that we can all enjoy thriving and better, meaningful futures. So everyone's well-being will look different, but we know that we can come together and through our state budget, invest in making sure every person can enjoy well-being. The state budget is a key tool for advancing well-being when it matches people's priorities, when policymakers follow what works and what we know works to ensure people and communities are well, when we ensure an adequate and fair tax code, and when we make sure that the budget process is transparent and inclusive. These are all key components of a well-being budget, and it's what we're calling on the North Carolina General Assembly to adopt as a framework that they should be using as they consider how to move our state forward and what investments to make this week, this year, and into the future. So with that overview, I'm going to turn it to my colleague, Sally, to share a little bit more in depth about what's the current state of the state budget is. Before I turn it over to Sally, I'll just mention that if you have any questions throughout the presentation, we will have time for Q&A, so please feel free to navigate to the bottom of your Zoom bar, and there's a Q&A box. You can enter in your question and answers. We'll try and answer in live time as well as provide written follow-up as well. So with that, I'll turn it to my colleague, Sally.
Thanks, Alexandra. So as we know, we are now almost 3 months into the new fiscal year, and lawmakers have yet to pass a comprehensive state budget. So what that means is that the state is largely operating under last year's funding levels, with no adjustments made for population increase, for inflation, for higher levels of need. Lawmakers did pass a small spending bill back at the end of July that underfunded the Medicaid rebase and that provided for some limited time-sensitive needs like increased enrollment in K-12 schools. But we know that piecemeal budgets like that fall short of what North Carolinians really need to plan for meeting current and future needs, and fall short of that well-being framework that Alexandra just described for us. And we know that when state government underfunds the needs of its communities, the burden is often passed onto local government and to families themselves to make up the difference with more limited tools and more limited resources. Next slide. So the source of disagreement between the North Carolina Senate and North Carolina House right now is largely around future tax cuts. As a refresher, back in 2013, North Carolina had a progressive personal income tax rate, meaning there was a higher rate on income above a certain level. And we also had a much higher corporate income tax rate. That corporate rate is the orange line, so almost 7%. After tax reform of 2013-2014, both those taxes were steadily cut over time, the personal income tax rate in blue, and again, the corporate income tax rate in orange. So we're now at 2025, and the lawmakers also scheduled future tax rate cuts far into the future. So by 2030, the corporate income tax will be eliminated, and the personal income tax rate will go as low as 2.49%, unless lawmakers change course. So the source of disagreement is that the Senate has said they want to go full steam ahead with these planned future tax cuts, and in their budget proposal, they also proposed going even deeper and quicker on those tax rate cuts. Whereas the House wanted to maintain the plan for the corporate income tax cuts, but wanted to moderate a bit on the personal income tax rate cuts. So next slide. And as a reminder, those current law rate cuts equate to billions of dollars in lost revenue each year. When fully phased in, North Carolina will be losing over $13 billion annually to personal income tax rate cuts and the elimination of the corporate income tax. Here, this chart is showing the losses from the personal income tax in orange and the corporate income tax in blue. And we can go to the next slide. And then finally, just wanted to share this slide as a reminder to always ask who benefits from proposed tax cuts. And wanted to share this as an illustration of what the House and Senate are really disagreeing about right now. So in this long session, we saw 3 different budget proposals from the governor, House, and Senate. And this shows the tax cuts included in each and how different income groups would benefit from those proposed cuts. So in the governor's plan, the largest benefit would go to North Carolinians with the lowest incomes, seeing a tax change of about $350 a year. And those benefits were largely driven by the governor's proposed working families tax credit. Meanwhile, the House and Senate plans provide the largest benefit to the top 1%. So those are folks making over about $700,000 a year. The House and Senate differ again in their total cost because the Senate wanted to go deeper and faster and the House wanted to moderate, but they still disproportionately benefit the very wealthy few in North Carolina. And with that, I think I'll pass it back to Alexandra.
Great. Thank you so much, Sally, for grounding us in what's at stake with no state budget and the importance of policymakers really focusing on that comprehensive state budget that pauses income tax cuts scheduled for profitable corporations and the very wealthy so that we can really meet people's priorities right now. I'm excited to turn it over to some partners and leaders from across the state to share their perspective on a range of issues facing our community in that matter for the state budget. I'm going to just give a brief introduction and encourage them to introduce themselves and their organization. So I'll just guide us through this section of the agenda with brief remarks from a range of speakers. And to kick us off, I'll turn it to Ashley with YMCA Asheville. Thank you, Ashley.
Thank you so much. Hi, everyone. It's great to be here with you all today. My name is Ashley T. I'm the Executive Director of Community Health for the YMCA of Western North Carolina, based here in the Asheville area. We wanted to touch a little bit on our participation in the Healthy Opportunities Pilot. We were one of over 100 human service organizations involved in that pilot across the state. That pilot was an innovative partnership between North Carolina Department of Health and Human Services and North Carolina Managed Medicaid, as well as local nonprofits in various communities. So that pilot was in 3 areas of the state, including Western North Carolina, the Fayetteville, Wilmington area, and sort of the northeast portion of the state, the Bertie, Pitt Halifax County areas. Unfortunately, that pilot, because it was through Managed Medicaid, was shuttered as of June the 30th, with the end of the last fiscal year, because the General Assembly did not fund the necessary portion of the state's required amount to continue that pilot. And unfortunately, that pilot had real detrimental impacts on not just the nonprofits that were involved, but the community that we were serving, because that pilot looked at how to address certain aspects like access to food, transportation, safe housing, interpersonal violence, and toxic stress. And so folks could qualify that were on Managed Medicaid for those services and get those services provided to them at no cost. But the best part was the nonprofit actually got a reimbursement for that through Managed Medicaid dollars. And so we were able to provide a service. We had over 200 clients a week that we were serving, healthy food boxes too, delivered directly to their door. So they didn't have to find transportation to come to us. 2 meals per person per day, really addressing the impacts of food security and ensuring they had consistent access to food. And through that pilot, we also were able to provide local farmers a source of income. We spent about $200,000 to local farmers in our Western North Carolina food system. And we're just one organization. Initial numbers are that $48 million were spread across the state in the food system, which is incredible, and a real economic benefit to not just nonprofits, but to those agriculture entities, as well as contractors for the housing domain, mechanics for the transportation domain. So a real interconnected network that was built through this pilot over the last 3 years, and now we're in a place that it's shuttered and we're not able to provide those services. We know this pilot works because research was done through Duke Margolis and the Shope Center for Research. And those findings actually came out that there was a cost savings to Medicaid claims of over $1,000 per person per year. And so that's substantive. But I think we all understand that the pilot is more than just the numbers, right? It's about the people that we served on a regular basis that now don't have consistent access to food, where they were in the process of getting a safe home, and now they're in this limbo of where they're going to live. So I think it's really imperative that we bring back this really essential program, and we need our General Assembly's help to do that, because Medicaid and Department of Health and Human Services isn't able to fund it on their own. So they need that appropriation or additional dollars from the General Assembly in order to do this pilot work, and invest in people and not profits. And I think that's the most important aspect of this pilot, is it really centers people at the heart of real Medicaid transformation.
Thank you so much, Ashley. So important to hear about all the evidence behind the work that you all have been doing and how it made people's lives so much better. Really a call for our General Assembly to act now on a state budget that invests in people's well-being. I'm going to turn it now to Beth Messer-Smith to share a bit more about what lies ahead for our state budget.
Thanks, Alexandra. I'm Beth Messer-Smith. I'm the state director for Moms Rising here in North Carolina. We're a grassroots organization focusing on the policies and investments that families need to thrive. We have about 47,000 members in the state across all 100 counties. And as you can imagine, access to affordable, high-quality childcare is critical to North Carolina families, to the folks we represent, so that parents can work and can contribute to the economy for their family's economic security, but also so that the children that we're raising can thrive in quality experiences with people who care about them. Unfortunately, North Carolina is facing a child care crisis. Emergency stabilization grants that helped raise the wages for the child care educators from about $12 an hour to about $14 an hour, those funds ran out at the end of March, and the North Carolina General Assembly has not moved forward with providing any additional funding to stabilize the child care system right now. As a result, 293 programs have closed just this year alone. And you can imagine the ripple effects of 293 programs and all of the children and families that they served, and what that means for those kids, and also for those folks' ability to work, and for the local businesses that relied on that workforce. The reality is parents can't afford to pay more for tuition, averages over $11,000 a child in North Carolina. And our early childhood educators and providers can't afford to make less. They're already surviving on shoestrings as it is. We're experiencing market failure, and we need to step in. A broad coalition of advocates, many of whom are on here today, have been working together to advocate for a child care subsidy market rate floor and overall investments in the child care system. But we can't afford to wait much longer. And it's time for our state's lawmakers to center people, not profits, in every single policy decision that they're making. Because we know that when families are well and our child care system is stabilized to provide care in our communities, our early childhood educators, families, and our economy will all do better. We'll all be more secure, better able to contribute, and to build the kind of state that we all want to be a part of. So we need to be making sure that we fund people's well-being, families' well-being, not the shareholders and CEOs and ultra wealthy in our state, who are really disconnected from the communities here in North Carolina. So really excited to be able to do this work with the BTC and with so many of you all on the call. But like so many of the issues we're going to hear about today, these investments can't wait, and we need our North Carolina lawmakers to act now.
Thank you so much, Beth. Really important, lifting up the value of childcare to people's well-being. We know across the state that we're seeing the impacts of a lack of investment at this point, and it is urgent, as you said, for state policymakers to put children's well-being first, ahead of corporate profits and the ultra wealthy. I think we'll turn it now to Lisa, if Lisa can join us to share a little bit more about the priorities that you're seeing in your work.
Hi, everybody. I'm Lisa Kelly. I'm Executive Director of WNC From the Ground Up. We are out in Silva. I'm kind of along the same area as Ashley. We became a human services organization for HOP post Helene. And I wanted to give you a little bit of the details of what we did. We were focused on the food also. Ours was farmer focused because we want to pay farmers a fair value. But with the HOP program, 40% of our clients were actually children. Probably another 35 to 40 were actually parents with children, and then we had a lot of elderly. But if you think about that and how many kids were fed, that's really hard to imagine it being gone. We started post Helene literally the week after, and we ended up increasing to 340 clients for a week with home deliveries in Jackson, Macon, Swain, Haywood, Clay, Graham, Cherokee. A few on the Eastern Band of Cherokee Indians Reservation. That was about to open up July 1st. So that's a whole population that did not even receive these benefits, besides a handful, because their Medicaid is a little bit different. I think that we just kind of assumed, because there was a 115 waiver, that it was going to progress, and we were going to have HOP through December 9th, 2029, or December 10th, 2029. And it's something that we need. Our community, I know I've talked to our county commissioners, and we are potentially losing $8 million in healthcare in our county alone. And, we're a rural county. We're not, some big county with a lot of population. Our population's about 36,000, and that's a lot of money to be left on the table that's not supporting our community. We are looking at options, but we definitely need something like Healthy Opportunities Pilot for our community. We have, on a personal level, a lot of our clients were getting to the point where, they would talk to us about housing, that they were about to get, in homes, and they were about to have all of this happen. And to have all of that yanked out from under our families, almost immediately. I mean, there was almost no time to adjust, And that I think was the biggest impact. We still have calls from clients, and we are still serving as long as we can 30 to 40 clients a week, whether they're walk-ins or we deliver them out of our own funding. But when you compare that to 340, that's a huge difference. And like Ashley said, we're one of over 100 organizations across the state or in the 3 regions of the state that we're able to serve, a ton of people. And if you just extrapolate that out into the impact that this has on the communities, it's rough. And sorry that I'm not more eloquent today. It's just kind of something that's heartbreaking that, we did $718,000 in HOP revenue, with 65% of that going to local and regional farmers, and all of that feeding the community. We definitely need to have something like this, or a program similar to this that, focuses on this population.
That's great, Lisa. Thank you so much. And you were very clear in your remarks about the importance of this program and the public investment in people's well-being that comes when we drive dollars into food assistance that connects with the broader food system. And I'd also just lift up, you raised the fact that so many families have been impacted and are still feeling the impacts of Hurricane Helene and Western NC. And, we have not seen that added investment there to the rebuilding that's necessary for so many families who are struggling to keep a roof over their head and food on the table. So another missed opportunity for the State General Assembly to really reconsider this fall as we come up to the key decisions this week at the legislature to really focus on what will make people's lives better. Thank you all so much for sharing your perspective and the issues that you've heard about from the communities that you're engaged in. We know there are so many issues that are facing North Carolina that our state legislature must focus on. And now we want to think about, how do we engage? How do we stay connected to the policy process as we go forward? I want to remind folks to enter your questions or comments in the Q&A box. We'll try to get to as many as we can in a few minutes. I'm going to turn it now, though, to my colleague, Danny, to share a little bit more about ways that you can engage. Danny, do you want to come in, and I will share the slide?
Awesome. Hey, y'all. Thanks for joining. My name is Danny Hoffpower. I am the Director of Community Building and Programs at the North Carolina Budget and Tax Center. And we're going to talk about 2 ways that you can stay updated, get engaged in keeping the corporate income tax and just finding out about real-time budget updates. So I'm going to drop the link in here, but you can also take out your phone right now, scan the QR code. But here's the first link to sign up for the real-time updates. We have folks sending out what's going on at the North Carolina General Assembly, what's going on with the budget in real time. And so you would get those updates directly to you, to your phone. And so that is a way that you can stay connected, stay up to date on all the things that are going on budget-wise. The second thing in here is our, it's what we've been calling our street teams. So just a little bit about this, this initiative. It's our street teams, they're hitting the pavement in North Carolina to really get the word out to everyday North Carolinians about how these corporate tax cuts are draining over $2 billion a year from our communities. The money that should be going to schools and childcare and clean air and water and safe infrastructure and so much more. A majority of the things we heard here today from our partners. So we want folks to get out and tell people that is going on, because not enough people even know that this is a thing that's happening. So we have team members who are hanging up flyers. Some are making their own groups. to hang up flyers, have conversations out in the communities with folks, and then also strategically place yard signs around their towns that directly link them to our CIT petition, our corporate income tax petition to keep the corporate income tax. And you'll see the two links in the side if it's not working for you with your phone. So those are two ways that you can get involved, engaged, tell people about the corporate income tax cuts. People do not know. We've spent so much time out in the communities, and when they find out, they are appalled. North Carolinians do not want this. It's very clear. And so the more people that know, the more we build a movement, and the more we build a movement, the harder we are to ignore. So yeah, share and come get some flyers out with us if you can, and sign up for our budget updates. And I'm not sure who I'm passing it over to for the Q&A portion.